Hello and welcome to Global Healthcast 61. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Schmitt, and with me is Dr. Melvin Sanicas. Good evening to Switzerland. Good evening, Melvin.
Good evening, Professor Schmidt, and good evening, good morning, or good afternoon to those who are watching us or listening to us today.
The topics we cover today is largely COVID, and it is about adults who exercised before the pandemic and risk of COVID infection, hospitalization, cognitive issues with COVID infection and fatigue, and then activity that help with just depression. And Melvin is going to cover these topics. So if you have a colleague or friend with long COVID or you suffer yourself, this is your opportunity today to hear what you can do about it. I speakly continue my series on side effects of COVID vaccines, measles in Europe and hepatitis E in Europe, and there is a vaccine out there in China. Having said this, Melvin, the first story is yours. Older adults who exercised before the pandemic were at lower risk of COVID infection and hospitalization. This is funny. Can you explain this?
Yes, so this is a study that was published in JAMA Network Open, where they analyzed data on over 60,000 adults with an average age of 76 years old. And they basically show that adults aged 45 and older who were physically active before the pandemic were 10% less likely to be infected with COVID. And they were also 25% less likely to be hospitalized because of COVID. And the study is actually really showing us the value of exercising, because after controlling for demographics, BMI, lifestyle factors, underlying illness, and even medications, those who were insufficiently active had no significant reduction in infection or hospitalization, while those sufficiently active had a significant reduction in infection and hospitalization. So it's really, I would say that this is a unique study in older adults, because they really look at the onset of the pandemic and really looking at the effect of being active before the pandemic, the COVID pandemic. So it's really showing us that exercising really helps enhance your immune function and lessens your vulnerability to infection.
Is there any argument why that is? What is the pathogenesis? What is the mechanism that exercise protects from infection?
I think it's really more of strengthening the immune system of the person, of the older adult. And also, if you exercise regularly, you are less likely to have, for example, let's say, how do we say this? Your blood pressures, for example, is controlled. Your blood sugar is better controlled as compared to those who are not exercising or who are just sitting down and doing nothing, right? So I think it's not really just protecting you from infection, but it's overall better physical health because you're exercising, right?
Yeah. I go to the gym, if possible, every day. So thank you very much for telling me that I should continue to go. I will go again tomorrow. So what is this with cognitive symptoms and post-COVID? This is interesting.
Yeah, so for this study, the question was, how are post-COVID-19 conditions self-reported cognitive symptoms associated with employment status, with functional outcomes, and with mood? And in the survey, around 15,000 individuals with post-COVID condition, or what we call long COVID, they reported 57% of them reported experiencing cognitive symptoms daily, compared with only 27% with prior SARS-CoV-2 infection who did not develop post-COVID conditions. And in those with post-COVID conditions, cognitive symptoms were associated with greater levels of depressive symptoms, greater reported functional impairment, and lesser likelihood of full-time employment. And of course, the bias or the limitation of this study is this is a self-reported study, right? A survey, and they were not really checked if what they reported was correct. But it gives us an idea that those who reported long COVID or post-COVID conditions, they are the ones who report depressive symptoms as well more often than those who did not have long COVID.
Interesting, yeah. So we see now much more studies on post-COVID coming out, the results of research from the past. Very good and very good news for all the many patients who suffer from the condition. And now what is this emerging infectious diseases paper about? Incidence factors for fatigue illness after SARS-CoV-2?
Yeah, so we talked about depressive symptoms and depression. And this is really looking at fatigue and chronic fatigue. So researchers from the CDC and the University of Washington assessed the risk of fatigue and long-term chronic fatigue in those who had COVID and did not have COVID. And the study was based on electronic health records of almost 5,000 patients with confirmed COVID between February 2020 and February 2021. So the earliest part of the pandemic. And outcomes were compared with 9,000 matched controls who did not have COVID. And basically, in the study, it showed that there is an observed association between COVID-19 and a significant increase in the incidence of fatigue and chronic fatigue in those who had COVID. So it reinforces the need for public health actions to prevent SARS-CoV-2 infections.
So we're back to, I guess nobody will wear a mask again and follow all the hygiene outlines and efforts that were done. So it comes down to get the vaccine, right? Maybe we should vaccinate.
Get the vaccine, eat better, exercise regularly, enhance your overall health, right?
Yeah. Interesting. And now you have something interesting, I guess, from WHO, right?
Yeah, this is just a sort of a review of all those previous global health casts that we had where we mentioned long COVID symptoms, right? So remember in the early part of the pandemic and even the second year of the pandemic, people were already talking about long COVID. We were discussing it, but the definition during that time was not very standardized. So this is the harmonized definition of what a long COVID condition or a post-COVID-19 condition is, or a PCC. It's a continuation or development of new symptoms 3 months after the initial SARS-CoV-2 infection, with the symptoms lasting for at least 2 months with no other explanation. So all these, let's say, brain fog, or let's say fatigue, chronic fatigue, and other conditions that happen for 3 months after the initial SARS-CoV-2 infection is considered long COVID.
Yeah. So the definition is 3 months after initial. Initial does not mean first. Is it the first or is it any?
Well, in the past, it was the first one, right? But now, because we know that you can be infected, it can be the succeeding infection with the SARS-CoV-2.
So we have to remember 3 months after infection, and it has to last for 2 months. And the symptoms you see on the left side. And no other explanation is a huge task for the treating physician. You need a lot of testing before you can say, I didn't find another explanation, right?
Yeah. That's a lot of work because we don't have at the moment biomarkers, although there are studies looking at potential biomarkers that can be tested, and there are many candidates already. And I think in the next couple of years, maybe there will be a test for that, but at the moment we don't have it.
Yeah. So this is the approach, right? People look for markers that go along with the infection and that persist with the symptoms, and then you can say with this pattern, you would expect that this is long COVID, and you don't need to look for cancer and for psychiatric disorders or whatever, but you really can diagnose positively long COVID. Interesting, Melvin. Great. Thanks for bringing this. I missed it, actually. Very good. And this is another wise. I saw that before we started. Very great. Can you walk us through this? What does it show us?
Well, for me, this is really important because according to the WHO, over 300 million people worldwide have depression. or depressive symptoms, right? And so it's really a big problem all over the world. And the reason why I thought that this was a really interesting study is because this is a network meta-analysis of randomized controlled trials showing that walking or jogging or yoga and strength training are more effective than other types of exercises in helping with depressive symptoms. And it's really, for me, it's really a strong message that doctors, healthcare professionals should always keep on messaging and telling people that they should exercise if they have depressive symptoms or depression, because it really helps. Of course, the limitation of this study is that some of the studies were low quality, and some of them were had basically some issues. But I think overall, the dose response association of the intensity of the exercise and exercising for long periods of time and regularly is really telling us that these things are helpful. Walking, yoga, strength training, they're beneficial in helping people deal with depressive symptoms.
Yeah. So the strongest is really walking or jogging, followed by cognitive behavior therapy and yoga. And
Yeah.
exercise, and I don't know, SSRI, I guess I don't see it anywhere, but basically exercise, right? So this is something.
I think it's also important to note that taking regular exercise can be challenging as well for people already with depression, right? Because they already are depressed, they have symptoms of fatigue, low energy, and they have poor motivation. So maybe they don't really want to exercise because they're depressed. So it's kind of a challenge, right?
A spiral, right? It is a self-fulfilling prophecy. You're depressed, you don't jog. You get more depressed, you don't jog. You're more depressed. So it's a downward spiral, I guess. Yeah.
Exactly.
Melvin, very, very nice. Thank you for bringing this. And this is also then relevant again for long COVID. Very interesting. Well, I started last week with side effects of vaccines, and I spoke about reactogenicity, anaphylaxis, technical errors, and vaccine-specific side effects. And for COVID vaccines that are out there, I showed that facial paralysis is caused by vaccination against COVID, but COVID vaccination reduces the natural occurrence of facial paralysis that occurs after infection if you're not vaccinated. So if you worry about facial paralysis, get your COVID vaccine shot. Today, I'm going to cover very shortly vaccine-induced thrombocytopenia and thrombosis. Basically, what happens, you inject the vaccine, and after some time, there is a thrombosis in any organ, and that may certainly be a severe disease, and it may even result in death. So this is the mechanism that initially people thought would happen. You have your vaccine, mRNA or whatever it is, and then the adenovirus vector vaccine, and then you give it, and then you develop antibodies, and the antibodies happen to be directed against platelet factor 4. But it was not known what is it that cross-reacts here. What is it that cross-reacts with this platelet factor antibodies? And what we know today, which has been elucidated very nicely, is it is the adenovirus vector. And the platelet factor 4 binds to the antibodies induced by adenovirus vector COVID vaccination. And once this happens, and again, this here should be then the adenovirus, the antibody with the platelet factor 4 binds to the platelet FC receptor. And this then results in activation of many, many systems, including platelet clearance by macrophages. So the platelets here are digested, they picked up by macrophages. And this is why platelets disappear and you start bleeding, because you need platelets to prevent you from bleeding. We bleed all the time, a little bit here and there, but platelets take care of it. And at the same time, activation of the platelet and local events result in thrombosis by activation of the clotting system. So now it is elucidated, this VITT, vaccine-induced thrombocytopenia and thrombosis is very close to this heparin-induced thrombotic event. And again, this is just to show the frequency a little bit. Initially, people thought any vaccine could do it, or we were not sure. But now you see it is only the vector vaccines, and the vaccine efficacy is very high depending on what you're using. And then this is the incidence of VITT. For some vaccines, we don't know yet because surveillance is not adequate for that. But again, look at mortality rates of 15 and 18%. Again, the event is rare, but at the same time, dying from a vaccine is really something that is hard to accept. So to summarize, only adenovirus vector-based COVID vaccines may cause VITT. It is seen roughly in 1 per 100,000 cases with a large error margin around it. It is diagnosed 5 to 30 days after vaccination. Clinically, you see thrombocytopenia and other effects. And there is thrombosis, particularly at atypical sites, like in the brain or in the venous sinus and splanchnic veins. Very similar to HIT, as I said. And again, the trigger is the adenovirus vector. Melvin, I'm going too fast here. Any comment on HIT and VITT?
Well, I guess the thing that I am thinking about right now is really what will happen to these vaccines, right? Because we always talk about the benefit risk of the vaccine. Are there other alternatives? Looking at the harm versus the benefit. And of course, in a pandemic situation, that's a different story, right? There's a pandemic. But now that the COVID pandemic is over, we still have the virus circulating, but the emergency phase of the pandemic is gone. We're not in that stage anymore. Yeah, so that's a different equation, I would say.
Yeah. Look, it depends a little bit. There is one other item to be discussed here, which is the price. These vector vaccines are really cheap and available to anybody. And then you have to make your decisions from a public health perspective. How many deaths do you prevent with vaccination by vaccinating only risk groups, or by having a strategy there? And how much damage do you have by the disease, and how much damage would you have by HIT and VITT? So this is something you have to decide about. I think, to the best of my knowledge, and I'm not 100% sure, to the best of my knowledge, adenovirus vector vaccines are no longer used in Germany. But this is alternatives are affordable here. But now that we know, I'm not sure if that would ever be used in a, let me say, rich country, right?
Yeah.
Very good. I have hepatitis E as the measles as the next topic. And after COVID, with wearing masks, hygiene measures, and I don't know what, viral diseases basically had gone, including measles. And I guess what we start seeing now is measles cases in Europe. And you see here 1,607 cases reported by ECDC. There's a huge outbreak in Romania down here. This is the big spot. But you also see 100 cases in France, 73 in Germany. And even in these smaller countries with less than 10 million people, Germany has 85 and France has 65, 70 million people. So these smaller countries with maybe a little bit more than 10% of the population, this is large numbers, right? 5 in Denmark, maybe more than 50. So there is something going on which we don't like. And again, measles is another potentially deadly disease, and we should do something about it. Any views from your side in Switzerland, Melvin?
Well, not particularly about Switzerland, but I remember a study a few years ago, this was before COVID, showing that infection with measles in the young actually does something to the immune system. Basically, it sort of resets the immune system, where the immune system forgets all the other viruses or pathogens that it has encountered in the past. So I think this is another reason, right, for parents to have their kids vaccinated with measles.
It is a wake-up.
Yeah.
It is a wake-up call. Something's going on here, and we speak about deaths in young children. So this is not funny.
It's always a cycle, right? Even before COVID, it's always like there are measles outbreaks, and then we talk about measles, and parents get the vaccine for their kids, and then they forget again, and then the anti-vaxxers come in again, and people don't want to get vaccinated again, and a lot of people will not be vaccinated, and measles will come back again. It's a cycle.
Yeah. Unfortunately, Finland. I'm quite amazed that there was a case of measles in Finland. They were the first to eliminate MMR, measles, mumps, rubella. Very, very long ago, and this was published in the New England Journal of Medicine by my friend Heikki Peltola. Very great paper. Interesting. I guess this is an imported case. Probably some German family visited Finland. There was the very sad story where a German student visited Finland and came down with a rash and some cough and respiratory tract infection. And Finnish doctors didn't even know the disease measles because it had been eliminated. And they thought this was strep throat or something. And the patient finally died, right? But look, measles may kill you because there is no treatment anyway. So there's nothing you can do wrong. But anyway, the diagnosis of measles was not even known at the time in Finland. And now they have a case here. I have to find out what's going on there. Hepatitis A and E in Europe. And actually, this is quite interesting. We already have 520 cases reported in 10 countries by end January. And there were unusual increase in cases from Belgium, Czechia, and Finland. In Belgium, it was genotype 3C. Please remember this for the next slide to show. And in Finland, the outbreak is associated with sausage, with metwurst, or salami of various brands. Very interesting, right? So you ingest the virus with the meat. And the CDC expects that there will be more cases. Actually, there is a nice report by ECDC showing that there was an increase from 500 cases a year to 5,000 cases, so a tenfold increase by 2015. So we had that before, and hepatitis E is really something to worry about, particularly in pregnant women. E increases in Europe, but there is a vaccine out there, and I didn't even know about it until recently. There is 10-year efficacy data of an hepatitis E vaccine called Hecolin, produced in China and used in China. Actually, what you see here is that the initial efficacy is up to 100%, but then after 10 years, it drops just to 88, 99, 90 something percent, which is great. So there is a vaccine out there. What is also interesting is that the incidence here in the placebo group is 2 per 10,000. This relates to 20 per 100,000. I mentioned the 20 per 100,000 because the threshold for vaccinating or for recommending vaccination against a severe disease like pneumococcal invasive disease is 100 per 100,000. So 20 per 100,000 is fivefold below this benchmark. But I believe if you would go to risk groups, pregnant women, people with other underlying diseases, there you may hit even the 100 per 100,000. So this is really something to look into. And I think this is really a great data to show a 10-year efficacy of above or around 90%. So this vaccine called Hecolin is the trade name, is a recombinant vaccine for the prevention of hepatitis E. It is virus-like particles produced or expressed in E. coli. It is approved in China for people aged 16 and above. It is well tolerated. 3 doses are given at 0, 1, and 6 months of age. However, the efficacy is largely against genotype 4. And I told you on the slide with the outbreak in Finland, that is in Belgium, that is genotype 3C. Now, I have no idea how genotypes relate to serotypes. So I have no idea what is the relation there. And again, it may well be that the vaccine is of no use in Europe. But then the question arises, why not look at the serotypes and why not come up with a vaccine? I mean, viral particle vaccines are out there or have been out there for quite a while, like human papillomavirus vaccines, right? They are virus-like particles, and the technology and expression of protein is nothing high technology anymore. I mean, it's difficult, but it can be done. So the question is, why don't we come with this? I think this is really interesting. What we do need for this vaccine is safety data and efficacy data in pregnant women. I think this might be something for women of childbearing age. And particularly, look, if we hit again this year 5,000 cases in Europe, we need to look at the risk groups, and maybe there's an opportunity for prevention there. Melvin, any thoughts on this one?
Well, I didn't even know that there was a hepatitis E vaccine until today.
Yeah. No, it was not on my radar either. So I'm quite surprised. And even more, it has been around for 10 years. I think we should plan a trip to China someday, Melvin, to look what other vaccines they have. I know they have an enterovirus 71 vaccine.
Yes, I know they have the EV71 virus vaccine and other kinds of hand, foot, and mouth disease vaccines. They have that in development. So I'm sure there are others.
Yeah. So maybe that should start us thinking about a trip to China. Any other comment on any of the topics we covered today?
No, I think it's very interesting to see all these developments, especially with the hepatitis E vaccine and the what we know now about the VITT and the HIT.
What we talked about today is Melvin convinced you that exercising reduces the infection rate for COVID. Cognitive issues and depression with long COVID, this is really important. And again, there are things you can do about it. Again, COVID is linked with fatigue, but there are several activities that were in this one study that Melvin sorted out: walking, jogging, yoga, thinking. I guess even watching our global healthcast would help you get rid of your depression or reduce the depression and maybe even long COVID. I spoke about COVID vaccine side effects, VITT, measles in Europe, a concern after the COVID gap we had. Measles is back again. And finally, hepatitis E in Europe. And there is a vaccine out there. The question is what we do without it. Melvin, what do you think today on my cartoon that I'm showing here?
I think it's it's showing the grand scheme of things, which people like to simplify things, but in reality, things are not as simple as it should be. I think it's also important to note that things could be simpler depending on how we view things. So I think it's all about the context, right?
Yeah. I think it would be nice to have this button here to know where you are, but actually, usually and very often you see all the data and you're simply lost, right? What does it all mean, right? I think this is really nice description of modern life in 2024.
Maybe Melvin, most of these things actually don't matter, right?
Yeah, focus on what is important. Melvin, This was a fun session today. Thanks, everybody, for joining us today. This was Global Healthcast 61. Join us again next week. Find the PDF of our presentation below in the links. Goodbye and see you next week.
Thank you.